Okay, we'll talk more with you. Let's see if Ibano is ready yet again. Dr. Adetola Adesanya, medical doctor. Many thanks for staying with us. Our guest here in Lagos has talked about how Nigerians, many people, are quick to take in malarial drugs as though they were taking vitamins. When they have a bit of a fever or a headache, next thing they say they have malaria, and they go over the counter and they are sold anti-malarial drugs there. How do we begin to address this issue of people self-medicating even when they don't know what is wrong with them?
Um, uh, um, well, the most of the issues with Nigerians and generally worldwide is that many people, they don't come to the hospital to present when they have symptoms of different illnesses. Now, malaria have some symptoms that are very common, like fever, headache, body pain, and some other symptoms. But when people have these symptoms, they go on to take medications, different medications. They go to a nearby pharmacy and give their complaints and give medications without any investigations. These are the factors that contribute to development of resistance towards the anti-malaria drugs that we have. Now, when you come to the hospital and you present to the doctor, you're going to be asked some questions to confirm if it is malaria or any other illness that is manifesting with the same symptoms. Then you are going to undergo examination. We are going to check you. You have some signs that we check for to discover whether you have malaria. And then we are going to run some investigations to actually confirm if it is malaria. Even right now, we have some malaria kits that are rapid, that within few minutes you can get your result. And then from there, we can manage the patient. And if it is not, then we can actually investigate further to find out what the problem is and treat the patient appropriately. So in short, many of our patients, when they go around, I've even had around, from my experience, people even go ahead to take antibiotics for malaria. They come to me and say, doctor, I'm having this and I think I have malaria, and they take maybe ciprofloxacin or some other drugs. And then in the course of that, they develop complications. And then when some of them take these anti-malarials, they take the inappropriate dose. Some take underdose, some take inadequate drug, and then the parasite keep developing resistance. And then this kind of parasite can also be spread. So when the mosquito bites such a people, they transmit the drug-resistant malaria to other people, and then we find difficult to treat. So these are some of the factors that are contributing to spread of malaria in our environment.
But let's still talk more concerning, management right now. A lot of people are quick to using homemade, medication, home therapy, to cure malaria or to manage malaria. Others would go as far as meeting some traditional herb mixers to give them, popularly called agbo in this part of the southwest, to treat the malaria. How potent are these traditional drugs, and are they really helpful, really? And do they have side effects? That's if they're actually very helpful.
Very much. Um, some of these herbal mixtures be given by the traditional carers. Some of them actually work, but the reason why they work is that over time, in the olden days, with frequent practice, they discover some leaves, some roots that contains some active ingredients that can actually take care of malaria. The problem with it is that some of these drugs are not prepared in the appropriate dose. They're not prepared hygienically, and when it is being given, some of them are contaminated. Some of them can even lead to poisoning. So what is there is that I want to give an example. For example, this popular medicine that we know around called dongoyaro contains quinine. Quinine is a drug for malaria, but to give it in the appropriate dose, they may not know. So sometimes when they take it, they don't get well on time, or if we know when they take, maybe they take the overdose of it. But when you come to the hospital and you present, we are going to calculate the appropriate dose that is needed to treat this illness. Another thing is that when you present and we investigate, there's also severity of this illness. Some people, they have just a little parasite infestation in their body, while some people, they have severe ones, and some even present with very severe signs and symptoms. Someone can even present with unconsciousness. Some people have cerebral malaria, that they'll be having convulsion. So there is an appropriate dose that is necessary to take care of all these treatment. And with the resistance to drug, sometimes some people have resistance to these drugs that they give. But when you come to the hospital, if you are not responding to a particular drug, you can actually move to some other ones that can take care of it. There was a time that chloroquine was working well for malaria when most of us were young. But now the drug has developed the parasite has developed resistance against this drug. But now, recommended by the Federal Ministry of Health, we have artemisinin-based therapy that we use for people this time around. So it's not that they don't work, but it's better to present at the hospital where you will be taken care of appropriately, and the appropriate dose will be given to take care of this illness.
All right, doctor, we will come back to you as we progress to get more information from you, but let's stay with Lagos for a bit. Dr. Ogunche, let's still talk more. What are the major public health challenges that we should be focusing as regards this fight against malaria?
I think the first challenge we should be looking at is the environmental sanitation part. Because if as a people we build a culture around clearing up, tidying up our environment, cleaning up our environment, seeing that the immediate environment is clean and is neat, we won't have the spread of mosquitoes across board. We won't have, even in our rural settlements, we won't have mosquitoes having a day or having a field day in developing themselves so fast and so rapidly. Another thing that I think we need to really, that is very key, is in the issue of educating the lower class.
Okay.
Because a lot of times, like the doctor in Ibadan just said now, when a mosquito bites a carrier who is already carrying the malaria resistance, and it takes it to another person, what you have is you are transferring resistance from one person to another. So if we educate the lower class in the society on what they need to do if they find these symptoms, instead of self-medicating or going over the counter, walk into a clinic. There are primary health centers all across Nigeria that you can walk into, and then you can get yourself tested if you have malaria or other complications. So if we educate people around us, if we educate people in our communities on what they need to do to prevent malaria, even sleeping under mosquito-treated nets, you find a lot of people who have nets, but they don't sleep under it. Some people say you have complaints of it becomes hot. It becomes hot when you sleep under a mosquito-treated net. It becomes it's too stuffy. You don't find yourself comfortable under it. So you find these issues where people, they have the net, the government gives the net to them, but they don't use it. So we need to educate people to use mosquito-treated nets. It's not enough to just have it in the house as storage or for use, or when it's doing distribution, you pick it up. Use it, because it's very, very important. You use the nets, you clear your environment, you ensure that even in your immediate surrounding, you use anti-insecticides. It's not enough. In fact, another challenge is the development of resistance to these anti-insecticides. You find a lot of these insecticides that are sold on the street, on the roadside. Mosquitoes have developed resistance to them because we have over-abused the usage. We have overused them. So you find that these insecticides used to work at some point, but then now it's no longer working. So education goes a long way in helping the citizens, in helping our own people get on in the fight and catch up with the fight against malaria, because it's something that is worrisome. In the statistics, like 25% of deaths in 2017 was from Nigeria. That's the highest across the globe. It's worrisome, really.
All right, let's go back to Ibadan right now. We have some questions for you, Doctor. Some people have sent in some messages. I'll just read them verbatim. This one says, please just remind viewers, when you send SMSs tell us your name and your location, where you're writing from, so we'll just be able to address you properly. This one is anonymous. He or she says, can malaria be transmitted okay, through sex? Is malaria contagious? Doctor, the question is for you.
The answer is no, it is not. The malaria parasite is usually transmitted by the female Anopheles mosquito. So usually transmitted through mosquito bite. But most of us have a residual number of parasites in our body, which are always kept in check by the body immunity. But when the body immunity is being overpowered, that is when you now develop the signs and symptoms. So malaria is transmitted only through mosquito bite and not through other means. Other ones that are uncommon is maybe through blood transfusion for people who are receiving blood, and you get blood from people who are already infected with malaria parasite. The likelihood to develop it is also there. So that's the mode of transmission.
People are still asking. People are still asking if malaria kills. Let's just talk about the seriousness now and how deadly or lethal malaria can be. How far can it progress into your system before it can come down to killing you? That's on the one hand. And secondly, let's talk about this cerebral malaria. What exactly is it about?
Okay. After the infection, there is always an incubation time of around 15 days. The sexual aspect of multiplication of malaria occurs in the mosquito. But when it gets to the human body, then it infects the red blood cell and multiply asexually. Then the red blood cell bursts and spreads into the body. Sometimes you can have pooling of this parasite into the liver. So apart from being in the bloodstream, it can also hide in the liver. Now, the general signs and symptoms that people present with is fever, headache. The fever is also typical. It is intermittent, it goes and comes. Most times it comes in the evening. And then when someone has fever, the body has a way of regulating or correcting the fever back to the normal temperature, and the person begins to sweat at that time. Other symptoms are headache, nausea, vomiting. Some people present with diarrhea, and then when we check on examination, some of them they will lose some of their red blood cells, so they become pale. So they are likely to have anemia. Then some of them have prostration. They are very weak. They always prefer to lie down. Then when we check their abdomen, their liver, their spleen can become big. Some of them will tell you that they are passing dark colored urine. When we check their eye, they can be jaundiced. So those are the general signs and symptoms. But when it becomes very severe, when you have not taken care of it, then it can progress and cross to the brain and also cause damage to other organs like the kidney. The kidney can fail so that the person will not be able to produce enough urine. When it's crossed to the brain, the person can develop convulsion or even go unconscious. This is the kind of malaria we call cerebral malaria. So these are the general signs and symptoms that people present with. So when it begins to cross to the brain, it also causes some other complications like severe hypoglycemia. Hypoglycemia means reduction of blood glucose in the body. When it reaches these stages, the person can die from there if the person does not get appropriate care. We also discovered that people who have malaria don't want to eat. They have loss of appetite. So someone who is not eating, someone who is vomiting, someone who is running fever, the person can become dehydrated, and severe dehydration can also cause death in malaria. These are the general general symptoms and signs for malaria and the severe forms.
Just before we let you go, the last question for you would be, Managing malaria in pregnancy, how do you go about that?
When a pregnant woman discovers that is pregnant, that is the appropriate time to book. Whenever you discover that you are pregnant, maybe you tested at home or yourself, or you tested somewhere in the hospital or in the lab, and you have been confirmed whether through urine or through blood that you are pregnant, that's the best time to present the hospital. You have to book for antenatal care. During this care, we are going to assess a lot of things, and part of it is also to check your blood. Then, if you have complaints at presentation, at booking, you will be asked. So if you have signs of fever, that is the time that we need to treat you immediately. We have drugs that we use to treat pregnant women in the first trimester, second trimester, and third trimester, because these drugs have a way of having effect on the fetus. So we are careful in the way we manage pregnant women. Now, another thing is that it is not all the drugs that a pregnant woman can take at any point in the pregnancy. When you also book, there's something we call intermittent preventive therapy. This is the prophylactic or preventive therapy we give to all our pregnant, because we don't want them to even have malaria at all, if possible, during pregnancy. Because if a woman has malaria in pregnancy, apart from other complications it has in a normal person, it also affects the fetus in a pregnant woman. It can accumulate in the placenta and cause anemia for the fetus, cause even malaria for the fetus. So the fetus can become anemic from accumulation of the parasites in the placenta, or even be deprived of oxygen. So we don't want you to get to this stage. So what we do is that we give them intermittent therapy, we give them some drugs. In the immediately they start feeling that the baby is moving, we start them on this drug, and we give them intermittently, like 2 to 3 times during the pregnancy, to prevent the parasite. And when they have it, let them present at their health facility. A pregnant woman, immediately you have any sign or symptom or whatever, quickly present, let them investigate you and treat you appropriately. So I may not be able to mention all the drugs now because of time, but we have our laid down management for pregnant patients.
Speaking with Dr. Adetola Adesanya, medical practitioner, who joined us live from Ibadan in Oyo State. All right, as we